SJ, welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. SJ, Stongo, Gary Fife, Jaho Jifkados, Mvskoke Radio, Mabo Hedja Wedgekis. Welcome to our program. Thank you for listening in. If you're all at home, let's use the time to the best of our advantage. We are going to continue our series in coverage of the coronavirus. We are hearing bad numbers nationally, and that the United States now is number one, but it's here in Oklahoma too, and even in the local counties. To discuss that, we have Kristen Carollo from the County Health Department region. She's here to talk about how the county is responding and what kind of things we found out so far about this deadly virus coming our way. Good morning, Kristen.
Good morning.
Thank you for coming in. We appreciate you.
You're very welcome.
First of all, let's introduce yourself. We got the name part down, but
Yes.
What about your title and what your responsibilities are?
So my name's Kristen. I actually work out of Mvskoke County Health Department, but the state health department is set up in regions, and I work out of Region 7 whenever it comes to emergency response, and I'm one of the public information officers. I actually usually am a wellness coordinator over in Mvskoke County, but for emergency purposes, we do have different job duties. And so mine is doing public information, getting messages out, getting information out, doing a little bit of social media and contacting the public on what is going on and trying to keep them up to date on information.
Well, I've been a PIO myself for the Anchorage Electric Utility. And
so you know the pressure.
Oh, yeah. And on top of that, we were also assigned to the state firefighting units, too.
Okay.
So that got a little crazy.
Yes.
So I know you've got a lot of bases to cover, and you have to be a jack of all trades and dispensing information that may not be your field into a manageable form for the public.
Yes.
First of all, of course, all the news headlines and things have been filled with stories about the virus and how it's affected us.
Yes.
Now, we wanted to bring it a little closer of course, for our Mvskoke Creek citizens, but for the community at large.
Yes.
So I guess we'll start off by wondering what the story is so far. What are the numbers of counties that you cover, first of all?
Right now, in Region 7, there are 8 counties, and I probably should have wrote those down so I could list those for you, but Adair, Cherokee, Mvskoke, Okfuskee, Okmulgee, I believe Haskell, Sequoia, and there's one I'm missing.
Is that Tulsa?
No, not Tulsa. Tulsa is its own entity. Tulsa City County Health Department and Oklahoma City County Health Department, their own entities because they are so large. They are separate but work with the state health department because of the mass amount of people in those counties.
Well, what you've just described then is pretty much most of the Mvskoke Creek Nation.
Yes.
We have 11 counties there.
Yes.
And you're covering most of them, but not necessarily just the creeks. You're looking at the community at large as a whole.
Yes.
We've been seeing the maps showing the numbers slowly rising that talk about the numbers of people who are now infected and having to be quarantined. What kind of numbers can you share with us, first of all?
So in Okmulgee County, there are 4 positive confirmed cases as of this morning. And I actually had a total number, but I have to add it up, and I don't have the ability to add it up right now. But there will be new numbers coming out for a total confirmed cases in Oklahoma. They usually come out around between 11 and 12 o'clock, and that'll get updated. on the website, the coronavirus.health.ok.gov. Again, that is coronavirus.health.ok.gov. It is a great resource for up-to-date numbers, information, resources, what to do if you're sick, information for businesses, how you should handle it if you are have been potentially exposed to someone who is a positive case. And so there's lots of great information on that, and there's phone numbers on there that you can call as well.
Okay. What might be the last numbers that you saw?
On like a total? Well, I know that...
Just a ballpark is good enough.
I believe it was 5. Let me look right quick, and I can tell you, because I believe as a state we had increased by about 100 is what we had. And the last number total was 565, and I believe the new number is about 665.
Wow.
And so, and it will increase. And the thing is that as testing increases, the numbers will start to increase, because we will get more of those positive tests back. Now, the numbers aren't there to scare people. They're there to make people aware of what is going on and make people aware of how much it is in their community. But those numbers are there to make people aware so that you can be taking the precautions. You know, a lot of people are calling in asking questions about, well, what can I do? What can you do? Wash your hands. Don't touch your face. Make sure you're staying at home, especially if you're a vulnerable population, such as our senior citizens or anyone who has an autoimmune disease or asthma or anything like that. You want to make sure that you are staying in, social distancing. If you do have to go out, it's only for the necessary items like grocery shopping, medical purposes, or if you need to go get medicine. Now, you can go out and walk, but they want people to stay home as much as possible.
I think that message is sinking in. I've noticed on the highways and streets, the traffic numbers are down.
Oh, yes.
Much thinner. Now, I guess a critical thing I had to do yesterday was get part of my lawn cut, because it's starting to get a little
It's
crazy.
getting tall already, huh?
Right, and so I had to get a wheel for my mower, and I went to the Lowe's down the road there, and walked in and noticed there were people wearing masks, and a few wearing gloves, and a mixed group of employees there. So I took that as a good sign, and even put on my own mask, and I had some gloves, but had dropped them somewhere. So it seems like people are paying attention now. It's not, that darn thing is way over there, it don't affect us. It is. It's here. It's home.
Yes, it is here.
Have you, has your department been seeing that sort of response from Oklahomans? Are they taking this message really seriously?
Slowly but surely they have. I actually live up in Tulsa County and work in Mvskoke County, and, you know, there for a little while there wasn't much change, but, you know, I drive 45 minutes to an hour to work every day, and I've slowly seen the decrease in traffic and people being out. And I've also seen an increase in cars at home and an increase of cars in driveways and people out and about, like within the addition that I live in. So slowly but surely, and I think too that goes back to the closing of businesses, like the non-essential businesses, and only keeping essential businesses open. And then, of course, there are some cities, counties, towns that are starting to do shelter in place or stay home, or even as of this morning, Tahlequah was doing a mandatory curfew from 10 p.m. to 5 a.m. And so there's things that are being implemented that are kind of forcing people to social distance and forcing people to stay home and not be out and about, which is what is the healthiest choice right now for a lot of people. That way we can slow the spread of COVID-19.
Have you had any discussion of essential businesses? I mean, obviously, you know, gas and food and those kind of things, but I mean, a lawnmower wheel, it doesn't sound really essential unless you see my yard.
Yeah.
But have you all had any discussions of what should be open and what maybe could be closed for a bit?
You know, as far as essential businesses, that directive comes down from the cities, the city officials, your local officials like your county commissioners, and your state legislators, and your governor or our governor. And so that's actually going to come down from them. As far as the state health department and public health, we are helping with the testing and the regulation and getting that information out as far as how that situation with COVID-19 is going. But as far as defining what is essential, that is left up to the cities and the city officials and our governor.
Mm-hmm. I think most people understand what's going on. Many stores have voluntarily closed, and you mentioned the small businesses who are going to get hammered.
Yes.
And schools. I mean, wow. I mean, when's the last time we had statewide, closure of schools?
I don't. You know what? I've never seen that.
Never.
Never. Except for, I think, maybe whenever we had, what was it, in 2000? Was it 2007? That big, huge snowfall, and we were out. They were out for like a week or something. You know. Yeah. But that's it.
That's Mother Nature reminding you of who's in charge.
Yes, exactly.
The effect we're seeing is going to be monumental, and it's still being measured. Now, what is the discussion among the state officials or the county officials? What's on the top of their agenda? What do they have to do first?
As far as the county officials, I don't have a lot of information pertaining to that. Each county is meeting on their own and having meetings with the regional directors within their region. And it's different from county to county based on what is currently going on within their area. And it can be different because maybe they don't have any positive tests yet, because there are still a few counties in Oklahoma that haven't shown anything. But it could be because there's a smaller population there, more a rural area, more country, and so people are a lot more spread out. But from what you see on social media, a lot of the representatives are wanting to try to get the information out to the public and get the numbers out to the public to make them aware. Or whenever positive tests started showing up, a lot of people wanted to get to let the community members know that there was a positive case in their county, which is understandable. And, a positive case cannot be spoken about until it's confirmed through the state health department. And so we have to wait for that information before we can say, yes, this is what's going on in the county, because what we don't want to do is confirm a case or say we have a positive case in a county and that be untrue and cause a lot of fear and cause people to go into a panic whenever it's not necessary.
Has the region, we'll refer to it as region now rather than county, have they stockpiled the necessary PPE, personal protective equipment, the masks, the respirators, that sort of thing?
I do know that there are available things for the health department employees to use so that if they do need to do a test or if they do need to be around someone who is possibly positive, that they do have what they need on hand. As far as a stockpile, each county is different. In each county, there are some places are, and I don't know if you've seen this on social media, but some places are actually donating from their stock to the health departments and to the hospitals or healthcare providers. And like down in southwest Oklahoma, there were a couple of schools that they're closed right now, and they said, we don't need this, we're not going to need this, and so they donated it to an area hospital in Norman. And so there are people that are coming forth and stepping forward to provide equipment for different hospitals and health departments to use. And so that is great, and we do appreciate that.
Well, God bless them all.
Yes.
One of the things we hear about is, I guess, maybe fatigue among our first line responders, the doctors and nurses who have to be there for these incredible hours.
Yes.
How are you dealing with that? Have you got some sort of staggered schedule for this area? We're going to have the people there?
So as far as the health departments go, the health department hours right now are 8 to 5. And of course, we aren't doing anything that causes an increase of people to have extended hours past that. We do have some people, like our lead nurses in each county, or if we have someone who has to go to a late night meeting, we do have some people that are having to stay past 8 or be there before 8 and stay past 5 or 6. And but we do have services available for our employees to access related to if they are needing someone to talk to, if they're needing someone to just vent to. We are putting in place some mental health resources for them to bounce off of. It's exhausting. Just doing 8 to 5. I can't imagine what it's like to be in the hospitals right now because we aren't in the hospitals and I'm not in the hospitals. But doing 8 to 5, you're working straight 9 to 10 hours unless you're there longer, and the calls are just coming in. The people are wanting information, and so being able to give people what they need or to reassure people, it can be mentally exhausting, and that's why we want people to be mindful of where they're going and what they're doing, so we can slow the spread of this and not wear everyone out. Because if you're a nurse and you're working a 12-hour shift and you just go and go and go and you don't have any breaks, they're going to get worn out. And I don't know how the hospital's handling their staff, but I would think that they would be making sure that their staff are okay. And we're reiterating to our staff, if you need a break, make sure you take a break. If you have a moment that you're just overwhelmed or stressed with everything that's going on, tell your coworker, go take a break outside, go step outside for a moment, because we want to make sure that people don't get burnt out right now, because this isn't stopping tomorrow. This isn't stopping, this weekend. It's something that we've got a few weeks of moving forward with and figuring out how we're going to handle it.
As a PIO, you must know what a 16-hour day is like, so I wouldn't imagine there are a few of our medical people who are seeing that kind of thing.
The days, like, whenever I try to go home I'm a mama, and so whenever I go home, I try to leave work at home. And I guess I got an email late last night with some information, and I waited to get it till this morning, because you do have to separate that time so you have the downtime. But I do know, like, as our first responders, firemen, police officers, EMTs, nurses, our doctors, as they get exposed and get sick, it's going to shorten the amount of staff. And so some of those staff may have to have longer days, may have to work longer shifts or work an extra shift. And so we want to make sure that we're taking care of anyone that is having to do those extra shifts or longer shifts, so they don't get worn out. Because if they aren't there to take care of us, we don't have anybody to step in. If our nurses are out and our doctors are out, we need them to be there. We need to take care of them.
Well, I can imagine, though, at the end of the day, people are just absolutely worn out, and that's probably where the mistakes might be made. Somebody's too tired to look at something, or didn't notice it because they're yawning or whatever. So I sympathize with them. Now, there's been a lot of talk recently about testing.
Yes.
So I guess from your position, we want to know what's the status here? Do we have stations set up for testing? Do we have enough of the tests themselves? What kind of response are we seeing? Are people, still together, or are they getting a little nutsy there?
So as far as testing, they do have on the coronavirus.health.ok.gov website. They do have, and I can tell you specifically if I can get this for you. There are 4 drive-through testing sites, and there is one in Tulsa County. I believe it's K County, and got that for you. Hold on just a second. K County, Pittsburgh County, Tulsa County, and Oklahoma County Health Departments. And so there are requirements for those testing. They are trying to get more testing supplies. They are trying to get more places to test. And it's not the fact that they don't want to, it's the fact that there's a shortage across the United States and across the world for testing supplies. And so there are lots of companies that are working on the rapid testing, that are working on increasing testing supplies. And so it's just a matter of time before that does come through. Right now in this region, we don't have any specific testing sites that you can drive through and come up to. Just anyone. You do have to meet, if you do have symptoms, they want you to talk to your primary care physician first. There are certain criteria that you have to be able to get tested, and they're trying to limit that to those that need it, just in case it's a high-risk person, and we need to know for sure what they have. And so hopefully soon they will get more testing supplies and be able to ramp up the testing so we know exactly the full extent of the numbers.
So Right now, it is not a good idea just to pop into your doctor's office or an emergency room and say, I want to get tested, because what you're doing actually is taking away the time and resources from people who might have something else.
Exactly. So you want to make sure that emergency rooms are for emergencies. We still have people out there that might get in a car wreck, might have a fire at their house and they need to go to the emergency room. Or you might have somebody who has a seizure or has a low blood sugar as being a diabetic and they need to be taken to the emergency room. We want to make sure that we don't overcrowd our emergency rooms and we leave those for emergencies. If you do have COVID-19 symptoms and you need medical attention, you can call 911, you can call your hospital, but you want to make sure that you talk to them first. You want to make sure that they know that you have symptoms so that they can take the proper precautions to protect themselves and to protect you. Now, the first line is for you to call your healthcare provider or your primary care physician, whichever you may have, and talk to them first about how they want you to move forward. A lot of people don't understand that it doesn't matter if you get tested for COVID or you don't get tested. The treatment is the same as of right now. They want you to quarantine. They want you to isolate yourself for at least 14 days and monitor your symptoms, monitor your temperature, and make sure that you're doing the hygiene and everything. So whether or not you get tested, the treatment is going to be the same. And I think a lot of people are missing that one piece.
And for our Mvskoke listeners, Jingo Okosis, wash your hands.
Yes, please wash your hands.
Now, what's the, I guess, if you can capsulize the message then you're wanting to put out to the public?
So we want to make sure that people are washing their hands and doing proper hygiene. A lot of people don't understand that washing your hands is at least 20 seconds. When you go to wash your hands, you turn on the water, get soap, warm water, wash your hands for at least 20 seconds, sing happy birthday all the way through, sing your ABCs a couple of times. Then you get a paper towel, turn off that faucet, throw that paper towel away, and then get another paper towel to dry your hands off. And make sure that if you do have to touch something after that, you can use hand sanitizer as well. Make sure that you are not touching your face. Proper hygiene. Cleaning your house. Let me tell you something. I know that you know this. Everyone made a run to the store to get cleaning supplies and everything. So if you have those cleaning supplies at home, make sure you're cleaning your house on a regular basis. Make sure your kids aren't touching their face. Practice social distancing. That means being at least 6 feet or more away from people. And so a lot of what I've seen up in the Tulsa area is people are congregating within their neighborhoods. You can get out, but what we don't want you to do is congregate in big groups because that defeats the purpose of social distancing. If you are standing several feet away and you're kicking a ball back and forth, that's okay. If you're going on a walk and you're social distancing, that's okay. But if you are, getting a big group of people together, having PE together with a bunch of kids, that could cause a spread of COVID-19. And so we want to just make sure that people are practicing those hygiene and making sure that people stay calm and be aware of what the numbers are, but don't have a panic. That's some of the things that we want to make sure that they're aware of.
One of the things we've seen recently was a news story about these young people going on their spring break and heading for the beaches, and there's thousands of them still. And I think one really stupid guy says, I don't care. If I get it, I get it.
Yes.
I don't want to miss the partying.
Yes.
So, I'm sure it struck most of the world as being really stupid. And I understand he actually did apologize for it. But this is the sort of thing you want to avoid, right? You're not invulnerable if you're a young person.
This does not, it doesn't pick you by age, race, ethnicity, anything like that. A good way to put it, and this is what I've heard, it's not a monster that is coming after you. You have to go get it yourself. So if you are out and about, if you're around a lot of people, you're more likely to get it. It's not something that's going to come find you. And so you want to make sure that staying home, it will be more beneficial for you to stay home, because it's, if you're out and about a lot, you're more likely to come into contact with it. And so, a lot of people did go on spring break. We saw in Louisiana that there was a very fast increase of positive cases down there right after Mardi Gras. And so, those spring breakers and the people who went out a lot during the last month, were seeing a great increase in the numbers in those states. And there's a reason why.
Right. That's like walking into a punch or something.
Yes,
All
exactly.
Right, go ahead and hit me. Yeah.
Yes.
The resources available now, I'm sure people are going to start looking for.
Yes.
And in the last couple of minutes here, we want to make sure that people know where they can obtain help if they need it, or more importantly, information right now that's starting at point one. So I know you've mentioned this before, but if you could go back and repeat some of that stuff, where people can turn for information.
Yes. So if you're here, anyone in any county that this reaches, you can go to coronavirus.health.ok.gov, and there's lots of great information on there. There's resources up there, and they update that website for numbers regularly, usually around 12 o'clock daily. And there's also resources on there about the drive-through testing, and resources for information related to what to do if you're sick, if you're a business. There's even information for myths and facts on there as well. Another resource which is new to Okmulgee County is the Okmulgee County Health Department is one of your first line responders here in Okmulgee County, and so they will have a hotline set up, and the phone number for that is 539-286-4582. And that is going to be a Monday through Friday, 8 to 5 number, that if you do have questions concerning COVID-19, that you can call that number and ask questions. If you have concerns, or if you're needing information specifically about, where can I get tested, you can call that number. And just be patient with them, because they may get an influx of calls and they may not be able to get right to you. But whenever they have that number set up, you should be able to leave a voicemail if they don't answer right away. But that phone number again is 539-286-4582. And so that's just a great resource locally here, specifically in Mvskoke County. Okmulgee County.
Right. Christine Cabello, please, thank you so much for making time and coming over here to talk with our listeners and share this information. We'll keep in touch with you as this thing progresses, digresses, if we will, and try and keep our listeners informed.
Yes, and our regional director, she actually had to step away last minute. She was actually about on her way here, and she had to end up going into a last minute meeting this morning. So she wanted to wanted me to give her apologies for not being able to make it this morning. So we were both running crazy to try to get here this morning. But we appreciate the opportunity to come speak with you and get information out to the community, and we appreciate giving the positive message out that this will end, and those numbers are made for awareness. So please just make sure that you're staying calm and just be mindful and make sure you're practicing safe behaviors.
Okay, great. Well, thank you for participating in a little Seat of the Pants radio here this morning. We're going to take a short pause here, and then I've got an interview from our archives with Joy Harjo, who has been named, of course, Poet Laureate for the whole United States. So we'll be back with her interview from earlier this year. So please stay with us on Mvskoke Radio.
Who am I? Am I native? I don't want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. Because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am. And meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Hear that? That's the sound of hope being killed by meth. Methamphetamine use is causing huge problems in our community. Hear that? That's the sound of something you can do about it. Events like rodeo, res ball, and family time can help keep kids away from meth.
Talk to your kids. Keep our culture alive. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Learn more at ncai.org.
This is kind of an overwhelming new, and you've got an incredible list of accomplishments here, but this, where does this rank among the things you've done there?
Well, it just depends on what you're looking at, because yes, this is as far as in the poetry world, in the world, in the creative world in which I've been working for many years. This definitely tops. This definitely tops it all.
Well,
and,
go ahead.
Oh, and then there's and then my children and grandchildren and great-grandchildren. I even have great-grandchildren. That also tops it all, too.
I can imagine now. I guess let's just start with what were your feelings when you found out this honor was going to be bestowed on?
Well, it was a surprise for one, and I got a call from Rob at the Library of Congress, and I know him because he organizes the National Book Fair, etc. And he said, "I need. Can you call about such and such a time? I just have a really quick question." And so I thought, okay, And then I called, and they said, "We have you on speakerphone, and this is Carla Hayden, the Librarian of Congress." And she says, would you be our 23rd U.S. Poet Laureate? And I'm stunned. I mean, I'm still stunned. I was told May 2nd, and I'm still kind of feeling this out, and I really had now that I'm in the middle of the first part of it, I had no idea, really, the scope of it, but it gives a great opportunity to represent for Mvskoke Creek Nation. It opens the door for our young people to say, wait, we can do this. We're, this is us too. And, it does it for Indian country and for, young poets and writers all over, young poets who are coming up, or young people who want to be poets and think, I would hope that it gives them some kind of this appointment will help them, will inspire them to just keep moving.
Was it difficult for you to, I guess, self-embargo this announcement? You said they called you on May the 2nd, so that's May and a good chunk of June there. So was it kind of hard?
It was in some ways and in some ways not. I got to hold off on it and just kind of be with the idea for a little while. And but it was a relief to. The announcement was a relief. But I'm in the midst of, this. I guess what's really struck me is by how many people are really happy about it, and these are usually people. They've seen me. People have seen me. I've grown up in the public. Basically, I started writing when I was in my 20s with 2 young children at home. I was pretty much a single mother, and came up through. I grew up here in Tulsa, and yet went away to Indian boarding school. It was an art school, and came back and had my son in Tahlequah, W.W. Hastings. We lived on nothing. Went back and had a daughter and went to school with this. The tribe helped me with money for school, and I'm always appreciative of that. And it's been a long road, and a lot of it's been a challenge because, when you're coming up as a young poet, you get a lot of doors slammed in your face. There's, You get turned down. I mean, I got turned down for a grant the other day. You know, that still happens. You just can't let it. You know, you just have to keep moving. But I guess what I'm trying to say that is along the way I've met so many people, and so many people have helped out. So many people have, you know, driven me to the airport, picked me up, made sure I was okay. You know, I've had students, friends. It's quite a broad circle, a wide circle, and I've probably been to almost every tribal nation in the country at some point or the other in my almost, you know, over 40 years of doing this. So I like to think it's all of us with this award. It has to do with this awarding or honor. I guess I should say an honor. This honoring is really about, you know, it takes in all of us.
You've opened quite a door there, and you've mentioned the tribe and its support, and meeting Native people from across the nation, and traveled and gained support internationally too. Now, all in all, as you stop and look at it, first of all, what do you think about this kind of heavy responsibility in representing pretty much all of Native America?
Well, it is a heavy responsibility, and as I've always said, because through the years, I've been in positions where I'm expected to represent everybody, and it's like, ultimately, you can't represent everybody. You can do the best you can to make sure that everyone has a voice.
And for Mvskoke Creek people, culture and history in your life, what kind of part did that play in, you think, in achieving this pinnacle?
Okay, can you ask me again?
Yeah, you're a Creek woman, and knowing Creek culture and people, and I presume some language. What kind of part did that play? Was it really important? Did it give you inspiration or direction, do you think?
Well, it's part of who I am, and I don't really I'm not self-conscious about it. It's just part of who I am, and I find Mvskokeness weaving throughout everything I do, and through all the poems, imagery, and meaning, and so on. And it's always, you know, it's always just me, and I'm part of the people, and I've been always inspired by our people and the stories and the songs and who we are and our history and how we keep moving, and you know, that's always been a part of me.
And as you move into this incredible position, what does it, I guess, do to the world of poetry and the structure in place? I mean, you feel like you're kind of shaking some foundations by adding this Native American flavor, so to speak? Well,
the point has always been that we are the original American poets, so to speak. You know, there's an incredible diversity of indigenous nations and indigenous nations poetry, and we form the foundation. And then layered on top and through are all of these immigrant nations. You know, and all of that makes what you would call an American poetry. But you know, we are essential to anything called American, whether it's American history, economics, anything. It starts with indigenous peoples and our contributions.
What is the job of a poet laureate? Have you had a chance to kind of examine that job, so to speak, and what will be asked of you?
Yeah, I guess I needed the job description first before saying yes. It's basically an honorary position, and I have an office there in D.C., but I'll stay. I'm living in Tulsa. I'll stay here, but go there once in a while. And but there are a lot of different. September 19th there'll be a big opening reading, and I'm excited that there's a group from Haskell already coming up, and a lot of other people. And you don't have to pay. There's no ticket cost. Anybody can come. So that's the first that's the first thing I have to do. And then if I do a second term, which is most likely, then I'll develop a project, and I'm working on that now. That will a national project, which of course in that project I want to highlight indigenous nations poets, but find a way for all of us to talk. Poetry teaches you how to listen, so it can be a way for us to talk across national, international, cultural dividing lines.
Well, when you speak of those lines and distinctions, I noticed over the past week or so that many of those distinctions have fallen by the side. I think this story about you and this poet laureate position has made more headlines, I think, than darn near any other Native story, except going back to Standing Rock and Dapple. I've seen it in AP. Of course, the networks have been using it, and I'm presuming NPR and others are standing in line waiting to talk with you. So you've made quite an impression there. So what's, I guess, the message that you want to get across and take advantage of this spotlight?
Well, I need to be quiet for a while and just look and kind of survey. But what's important is this country, this earth, this place that is our home, this place that is us, because we're not separate from this earth. And we're in need of healing. We're all in need of healing. There's been, certainly from history, but from history, from just we're in need of. I guess what I'm trying to say is that I love our young people. I watch them. I've got grandchildren, great-grandchildren, and what I was told by those people who know things is that they're all our children. And I look at this world that we're in right now. It's so divisive. It's so much hate-mongering, and it hurts. It's hurting. It's hurting the children, and it's hurting the young. It's hurting us. And so, if I would like to see how I could be useful with this platform and with poetry, because with poetry and how poetry can be useful in moving us along towards compassion and understanding.
This direction that you've taken all your life, was it really something that you set out to do when you began this creative trick? Saying, oh boy, I want to be a poet and really be famous. But all the stories of poets that I've ever seen have been, those kinds of things of hardship and acceptance. You're not going to get rich being a poet, most likely. And so was that ever part of your thinking there? It's like, I guess going back to the initial question, I want to be a poet.
If I wanted to be famous, I certainly wouldn't be a poet. Or if I went into poetry, I don't even feel like I chose to go into poetry. I've always felt those people, our ancestors, I've always felt them close to me ever since I was a very small child. And they've always protected me, and they do, all of us. Nothing special. We all have them with us. And, even when I would go the wrong way, and they would always knew when I was making the wrong direction, and I went through a lot of hardship and a lot of it my own doing. It was poetry that helped me out. And at one point, I was poised to become an artist like my Aunt Lois Harjo and my grandmother Naomi Harjo. And I liked painting and I liked doing art, and I didn't have to talk to people because I was very, very shy. But there was something, I remember I was going through a lot of hardship. I was a young mother. I was going through domestic violence. I was suicidal. And I didn't know how I would keep going. And they basically handed me a pen and said, kept me from, said, we will show you the way, but you have to listen. So for me, poetry is a way to sit and be quiet and listen. And so then I listen. And then But poetry is like any other art. You don't just write something down and there it is. You work on it. There's a process. There's a challenge. Sometimes a poem might take a year to write. Other poems might take 6 months, some 3 months. But it's been quite a teacher for me. But no, I didn't set out to be a poet. I wanted to be an artist. And then the poetry came on me, and it's like, this doesn't make sense. I didn't plan to be a poet, and yet that's, at some point, it was given to me to do, and I just had to do it. I wanted to make a living because I have children, and I often taught to make a living. And, the book sales, even if your name's out there, you can't live on book sales or CD sales. But you just do it because it was given to you to do. And I have, I've been given poems that I had no idea, I just knew that they came from that place where the people loved us. And so I feel like I've just been taking care of them. I call myself the nails and hammer person. And I'm given sometimes this startling and sometimes beautiful language, and I try to lay it out. It's sort of like making a ribbon skirt. I've been making some of those lately. It's like you're given this beautiful materials and these words, and then I just construct them in a way that might go on and help some other young person like I was, who looked at the mess we're in and thought, I don't know if I can make it through.
Let me ask you about that inspiration. I read a lot of your work now, and your autobiographical piece, and listened to that rowdy saxophone of yours. You have so many directions. What is it that inspires you to create?
A lot of it has to do with, I think, beauty and healing, the need to help and to just inspire. I mean, I think we all get inspired by sunrise, by certain smells. I love the sound of all those insects. I love being up, watching the sky, the stars and the sky move when we're up dancing all night, and being with everyone, and the sound of, there's just so much that inspires us. And we all get inspired, but I think it would be helpful if everyone, you write little notes down so you remember. That's kind of what poems can be too. It's like, sometimes it's like a kind of spiritual note-taking of things that strike you, and so that you want to remember them, or sometimes it's like that. Sometimes not. Sometimes you see something else that is hard to write about, but somehow by doing it, you help others.
I was going to ask you about the things that are, as you said, hard to write about. Much of your work deals with some painful and very introspective kinds of things. So by expressing them creatively, is that sort of a release? Is it a way, a therapy, if you will?
It can be. It's not pure therapy because I'm making art. There's a lot of stuff I write that nobody ever sees. It's just that, that stuff just for getting stuff out. I think it's helpful, because then you can stop. You can get angry, you can get upset, but then you can stop. Once you get it out, then you can stop and say, okay, let's just take a breath here, and now I've dealt with that energy, and let's see where we can go. Is there a way to go that can be constructive, that won't hurt anybody? I don't want to cause any pain, yet sometimes it's painful to see the truth.
I think a lot of people who are familiar with your work would quickly agree with you and find a way that to share that release, perhaps. Now let's look at the sunny side of that question. Is it fun? I mean, are there times when you just get a real kick out of putting something down or putting it together? Just kind of make you smile and laugh and enjoy what you do?
Of course. Even in the midst of all that, even when I'm writing about challenge, there's so much excitement in using language. But I think one of the funnest things I ever did was a song called the Had It Up to Here round dance song. I decided to do this kind of round dance song of a couple arguing at a dance. And so I brought Charlie Hill. I lived in LA for a little while, and there's a period I was running into him everywhere. We'd run into each other in the street, and we became really good friends. And so I got this idea for a song, and I scripted some of it. And I brought him into the studio, and we started recording. And then, he's a comedian. He's very funny, and he started ad-libbing, and then I ad-libbed with him, and we had such a good time. And it made a really fun song. And now I'm glad I have that, because he's not with us anymore.
Right, and even I understand when he was in the hospital, he was still cracking jokes and breaking people up. So,
yeah.
Now, the position of poet laureate, I presume would have to deal with requests from whoever. The events that happen in the nation, important personal kinds of things that happen to Americans. Are you looking at having to produce, so to speak, to meet these kind of requests?
There's been requests all kinds of requests pouring in, and then I've heard from people that I've known through the years, and people I don't remember knowing through the years, but it's been quite an outpouring. There's some events from the Poet Laureate office, and then there's other events. I'll be doing what I've always done too at the same time, which is I have my usual events of going to schools, going to music festivals or poetry festivals, and presenting poetry and music, or one or the other, and I've been doing that for years, and I'll continue doing that. And then I have this new book, An American Sunrise, coming out, and I just had a book out, a play called Wings of Night Sky, Wings of Morning Light, and I'm working on a musical project. And so I'm going to do what I've always done, but added will be this responsibility, and also I'll be thinking about a project that will benefit us and help move us forward. And especially I especially think of those young people, those teens out there who are really struggling to find meaning.
What kind of reaction have you gotten from the American public so far? I know it's only been a short time since the announcement's been out, but you mentioned you've gotten a lot of requests. I think that's wonderful. But, are they saying, hey, we finally got an Indian in there, or it's about time another minority was served, this kind of thing? Or are people really genuinely curious about who you are and what you'll be doing?
I think it's a mix, but there's a lot of, I've been out here for a long time, and so I've been really overwhelmed by a lot of people who said they've been crying, because a lot of people have known, I guess, particularly the struggle of Native poets to even get a place at the table. And for the most part, we kind of go along and we do what we do. And I think with Standing Rock really was major in opening up this story, because here in the middle of the country, there was, the earth crisis came to a head right in the middle of country and right in the middle of Indian country, of course, and so that brought Native country into focus. And so this, I think, kind of builds on it. And people are really, people are excited, and I am too. I mean, I'm excited too, because I feel that this is a great opportunity, not just for me, but for all of us to say, well, here we are, and we're part of, we're here. That Illuminative, and I don't know if you've talked to Crystal Echohawk and Illuminative people, but they're doing great work of providing data that shows that, well, a lot of Americans think that natives they think that we're dead, for one thing, or they think that we're not really human beings.
Right. I found that they know more about our dead ancestors than they do the tribe living down the road.
Yeah. I had a wonderful young assistant when I taught at UTK, and he realized he lived next door to a tribe in Michigan, and nobody knew each other.
That's so true all over the country.
It is, and I would like to open that up,
Well, you have an interesting and wonderful opportunity there. What is, I guess, the message then that you might want to give the rest of the United States?
Oh, message? Oh my gosh. Well, I think poetry is about, it's the art. Poetry is really the art of listening. And we all need to, and you can't listen if you're talking or yelling at someone else or calling somebody racist insults, or you can't listen. If you got earbuds in all the time, or you're constantly, enthralled with your phone, or we need to stop and listen.
Right. I've heard you use that phrase when I've had the opportunity to talk with you. What is it that maybe you want to hear from Native America, if there is a message coming to you, so to speak?
What I love, we're so diverse. Even in our families, we're diverse. There's so many stories that, our stories are so complicated and incredible and hilarious and disturbing and full of details that go way beyond, the stereotypes are just these flat images that aren't full of life, and we have stories of life that connect us. I think we need to hear those to make the connections with each other.
Right. Now, I guess final question, if there was some word, some thoughts you might want to leave with the Mvskoke Creek people who will hear this, and my friends online who have been asking about it, what would you want to say with them? How would you want them to think of this particular legacy, so to speak?
Well, I think that that we all need to pay attention to our words. I mean, poetry is an art that involves using words. And words they can destroy or they can heal. And in our nation, we've got so much, there's so much work we have to do to, for all of us, for our generations. We have so much to do. We got so much to do. We should focus on moving forward together instead of, tearing each other down or all the stuff that can go on in a close-knit community that's we are a big family. We're all related. Anybody you come across, and we need to remember that, we're here to lift each other up, and that's what I was always told. That's one thing I've always heard with my relatives and those people. I so miss all these people that are leaving us. It's so hard. That's the hardest thing about getting older, and we miss them, and that's the one thing. So we have their legacy, and my poetry would not be where it is without the legacy of those people who were my teachers. And for one, they were always funny. They didn't judge people. They were always funny, and they always had a way of seeing things in which, we all come out okay in the end. And that's what I would like our people to remember, and myself. I always try to remember, but and we need to come together and move forward in that way.
Thank you so much, Joy Harjo. You make us so proud. Good luck with everything you do there, and keep us in mind, and let's see what the new U.S. Poet Laureate produces there. Mado.
Okay, Mado. Thank you.
Joy Harjo earlier on being named the U.S. Poet Laureate for for Native America, yay, and of course the rest of the country. We're so proud of her. We want to remind you here we've got changes at the Department of Health, new pharmacy policies. Those things will be called automatically. So in the meantime, we're gonna say catch us next week. We got to get moving here. So, Mado. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. Mado.